Hello guys, hope you're all okay. You're all enjoying your life and you're also enjoying watching my videos, and you're also enjoying practicing radiology, practicing ultrasound as well. So we are again on the course of discussing bone tumors, and especially related to congenital abnormalities. So today I'm going to discuss about the congenital abnormalities, its presentations on the bone. But before going to start, I would like to say thanks to Wise Stylo, this beautiful sweater which I have wore today for the video, that's gifted by the Wise Stylo. It's offering really quality stuff and it's worth paying there. You can go and watch there, and there's a lot more to see and lots more to enjoy, and yes, start buying there. So I'm gonna start about the musculoskeletal congenital abnormalities, and the first comes is osteopetrosis. Osteopetrosis is a very common one, and it has characteristic radiological or radiographic appearance that would be hyperostosis and sclerosis. These two important points you can pick on the radiograph, and so far the distribution is concerned, you can see it within the skull, and especially it involves the spinal area. What happens and what's the pathology in osteopetrosis? Actually, there is a abnormal formation of the osteoclast, which causes imbalance between the bone resorption and bone formation. It has two types. The one is infantile type, which is called as autosomal recessive, and the another one is adult type, autosomal dominant. What you can pick on the radiograph. On the radiograph, there are three important features you keep in mind. The first thing is undertubulation of the metaphysis. On the metaphysis, undertubulation can be easily picked on the radiograph. And the second, which I really like the most, and it's really typical, and that is bone within a bone appearance, and this is a very particular characteristic you can easily pick on the radiograph. And the third one is you can either see the sandwich vertebra or you can see the Rugger-Jersey spine. So these three are the radiographic appearances you can pick for the osteopetrosis. If you want to do MR, so on the MR there will be black bone, and if you want to do scintigraphy, on the scintigraphy this would be a super scan. So these are all the features related to osteopetrosis. How it will appear, how you will appreciate all these three features on the X-rays. Let's start watching these images for the better understanding.
Osteopetrosis is also known as marble bone disease, and what happens in osteopetrosis is abnormal osteoclasts functions creates imbalance. So there are two types of the activity: osteoblast activity and osteoclast activity. What happens with osteopetrosis is osteoclasts creates an imbalance between the bone formation and the bone resorption. As a result, osteopetrosis happens. There is mainly two types of osteopetrosis: infantile, which is autosomal recessive disease, and in the adult it would be an autosomal dominant form. So these are two forms: the infantile form and the adult form, autosomal recessive and autosomal dominant. As far as radiological pathology is concerned, undertubulation of the metaphysis can be seen in osteopetrosis. The another very characteristic form is bone within a bone appearance can be seen on the radiograph. And in the vertebra there may be two forms of presentations. The one is either Rugger-Jersey spine or sandwich vertebra. So these three pathological processes can be seen, and the bones will be either undertubulation at the metaphyseal point, and the bone within a bone appearance would be a very classical appearance of the osteopetrosis. And if the spine is involved, so you may be able to see the Rugger-Jersey spine, or there may be a sandwich vertebra appearance. So let's start looking for all these appearances on the radiograph. On this hip and lower extremity radiograph, you can appreciate that there is undertubulations of the metaphysis at bilateral femur. So in the bilateral femur, undertubulations at the metaphyseal points can be seen on this radiograph. The classical appearance bone within a bone can be seen at the ilium bone. Look at the ilium bone here. You can see like there is projection of the bone on the another bone. So this is what the classical appearance called as a bone within a bone appearance, and this is very common in osteopetrosis. On the basis of this characteristic, you can easily recognize osteopetrosis. Here the another classical appearance, flask deformity. Here you can see these both arrows are indicating the distal part of the femur is slightly widened and distended as compared to the proximal, and giving rise to a particular flask shape deformity. This is also an appearance in the osteopetrosis. Here you can appreciate that the inner table of the skull is sclerotic. As so far osteopetrosis is concerned, as I mentioned, that the main pathology is hyperostosis and sclerosis. So here this sclerotic border can be seen, and beside this you can also appreciate a classical feature of hyperostosis. So hyperostosis of the external or outer cranial table can be seen associated with sclerosis. So this is the characteristic features of the osteopetrosis. So osteopetrosis can be picked on the basis of the hyperostosis and sclerosis.